to pacemaker or defibrillator. What should you do if you are taking warfarin, Aliquid? If you are taking warfarin, you should not hold your warfarin. However, you should reject your INR prior to the procedure. Make sure your INR is therapeutic. If your INR is elevated or critical, and make sure to follow your doctor who manage your warfarin or the anti to hold your warfarin or adjust your warfarin dose to make sure it is therapeutic before the procedure. Aliquid or Badaxa, you should make sure you don't have any bleeding complication of the procedure. You should continue to take the alcohol or Badaxa, otherwise as indicated, instructed by your surgeon or procedure. Question or concern for me in the comment box below. Prior to pacemaker or defibrillator placement, what should you do if you are taking warfarin, Aliquid, Xarelto, or Badaxa? If you are taking warfarin, you should not hold your warfarin. However, you should reject your INR prior to the procedure. Make sure your INR is therapeutic. If your INR is elevated or critical, and make sure to follow your doctor who manage your warfarin or the anticoagulant to hold your warfarin or adjust your warfarin dose to make sure it is therapeutic or at the goal level before the procedure. If you are taking Aliquid, Xarelto, or Badaxa, you should check your kidney function to make sure you don't have any bleeding complication of the procedure. You should continue to take the Aliquid, Xarelto, or Badaxa, otherwise as indicated, instructed by your surgeon or proceduralist. If you have any question or concern for me, please let me know in the comment box below. Thank you. Prior to pacemaker or defibrillator battery change, what should you do if you are taking platinum medications such as warfarin, Aliquid, Xarelto, or Badaxa? If you are taking warfarin, you should not hold your warfarin. If your warfarin is therapeutic, if your INR is elevated or critical, then you should reject your INR prior to the procedure. It's best if your INR is therapeutic before the procedure. If you are taking Aliquid, Xarelto, or Badaxa, you should check your kidney function. Do not hold unless otherwise as indicated. You should follow your surgeon or procedure list instruction. If you have any concern before this, please let me know. Comment box. Thank you. Prior to pacemaker or defibrillator battery change, what should you do if you are taking platinum medication such as warfarin, Eliquis, Xarelto, or Adaxa? If you are taking warfarin, you should not hold your warfarin. If your warfarin is therapeutic, if your INR is elevated or critical, then you should recheck your INR prior to the procedure. It's best if your INR is therapeutic before the procedure. If you are taking Eliquis, Xarelto, or Adaxa, you should check your kidney function. Do not hold as indicated. Your surgeon or procedure instruction. If you have any further questions before this procedure, please let me know in the comment box below. Thank you. What should you do prior to lung biopsy procedure if you are taking a blood thinner medication such as warfarin, Eliquis, Xarelto, or Adaxa? If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If your INR is therapeutic and you are stable with your warfarin, like you have a stable INR history, then you should hold your warfarin for 4 to 5 days prior to the procedure. If you have a critical INR like over 5, then you may need to hold your warfarin and then reduce your warfarin dose and recheck your INR in about 1 week prior to a procedure. If you have to hold your warfarin for more than 3 days, you should reach with a luminal injection to prevent from recurrent blood clot or stroke. You should follow your doctor or the anticoagulant for breaching instruction. If you have to take the Eliquis, Xarelto, or Adaxa, you may need to check your kidney function. If your kidney function is normal or creatinine clearance greater than 50, then you might only need to hold your Eliquis, Xarelto, or Adaxa for 2 days. If your kidney function is not normal when your creatinine clearance less than 50, then you may need to hold your Eliquis, Xarelto, or Adaxa for more than 2 days. When you hold 2 days, then you may need to resume your Eliquis, Xarelto, or Adaxa. You should follow your surgeon or procedure list to resume your blood thinner medication. Any question, you should check with your doctor who managed your blood thinner medication or your anticoagulant. If you have any question for me, please let me know in the comment box below. Thank you. Prior to lung removal procedure, what should you do if you are taking platinum medication such as warfarin, Eliquis, Xarelto, or Badaxa? If you are taking warfarin, you should recheck your INR in about 2 weeks prior to the procedure. If your INR is therapeutic and your iron level, then you may need to hold your warfarin for 4 to 5 to the procedure. If your INR is critical or elevated, your doctor who manages your warfarin or clinic might need to hold your warfarin or reduce your warfarin dose and recheck your INR to make sure your INR is good before they can plan for your procedure. If you have to hold your warfarin for more than 3 days, then you may be rich with your low injections to prevent from having recurrent blood clot. Or if you are taking alcohol, or Badaxa, you may function. If the creatinine is less than 50, you may need to hold your Eliquis, Xarelto, Badaxa for more than right. If creatinine clearance greater than 50, then you only need to hold your Eliquis for 2 days prior to the procedure. You may need to delay to resume if you hold for more than 3 days. You need to follow your doctor or the anticoagulant instruction. You should resume your platinum medication as instructed by your surgeon or procedure list. If you have any further questions, please let me know. Thank you. spleen surgery or the vascular surgery related to spleen. Prior to spleen surgery, what to do prior to spleen surgery if you are taking warfarin or Eliquis or Xarelto or Badaxa. If you are taking warfarin, you should recheck your INR in about 2 weeks prior to the procedure. If your INR is at therapeutic, you should go ahead and hold your warfarin for 4-5 days prior to the procedure. If your INR is a little bit elevated, you should adjust the dose a little bit and hold your warfarin for 4 to 5 days prior to the procedure. If your INR is very elevated or critical, then you need to hold your warfarin and reduce the dose and come back in about 1 week to make sure your INR improve, get back to the therapeutic level. Then before you can plan for the procedure. Anytime you need to hold your warfarin for more than 3 days, then you need to switch with the Lovenox injection. If you have a history of recurrent blood clot or stroke and strong risk factor of having blood clot or stroke, such as factor V deficiency. If you are taking the Lovenox injection to bridge when you off warfarin, you need to follow your doctor who manages your warfarin or the anticoagulant instruction closely. Make sure you understand when you need to start the Lovenox injection, when you need to stop the Lovenox injection before surgery, when you need to resume after the surgery, and when you need to completely stop the Lovenox injection therapy. If you are taking Eliquis, Xarelto, or Badaxa, you should check your kidney labs, make sure they are up to date. If they are more than 3 months old, then you need to update the labs. For those people who have kidney problems, such as kidney failures or chronic kidney disease, they should get the update lab. They should get the update lab sooner than 3 months. If they have a normal kidney function, if your kidney function is low for 2 days and resume the day after the procedure. If your kidney function is not normal, your creatinine clearance less than 50, you might need to hold more than 2 days, and you might need to delay resuming your Eliquis, Xarelto, or Badaxa. You also need to check with the surgeon or proceduralist to make sure if you are safe to resume your platinum medication. When is safe? When you are safe to resume your platinum medication. If any different, you should update to your doctor who manages your warfarin, your anticoagulant. If you have any further questions, please let me know in the comment box below. Thank you. Liver surgery or vascular surgery related to liver. What to do prior to liver surgery if you are taking a blood thinner medication such as warfarin, Eliquis, Xarelto, or Badac. If you are taking warfarin, I will recommend that you should recheck your INR about 2 weeks prior to the procedure. If the INR result is therapeutic, then you should hold your warfarin 4 to 5 days prior to the procedure. If the INR result is slightly elevated, then you should and hold 4 to 5 days prior to the procedure. If you elevated INR or critical INR, then you may need to hold your warfarin and reduce the dose and come back in 1 week to recheck your INR to make sure your INR improve, return to therapeutic range, plan procedure. So your doctor who manage your warfarin anticoagulant closely should you have a appropriate plan. Anytime you have to hold your warfarin more than 3 days, I would recommend that you should consider with the Lovenox injection. If you have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke, such as factor 5 deficiency or some kind of genetic. If you have to reach with the Lovenox injection, follow your doctor closely, and when start Lovenox, when to stop Lovenox for the surgery, and when to resume your Lovenox injection after the procedure. When completely stop the Lovenox injection therapy. If you are taking the Eliquis, Xarelto, or Badaxa, you should check your kidney labs. Make sure they are up to date. Treatment. If you have kidney problems such as kidney failures or kidney disease, you need more labs than the. If your kidney labs within normal limits, then for 2 days. If the creatinine clearance not within normal limit was less than 50, then you may need more than 2 days. You should Xarelto or Badaxa the day after the procedure if your kidney function is normal. You should resuming your Badaxa if your kidney function is not normal. And resume 2 to 3 days. You should also check with your surgeon or proceduralist. Make sure you are safe to resume the blood thinner medication. If any difference, you need to talk to manage your platinum medication or your anticoagulatant. If you have any question, concern, please let me know in the comment box below. Thank you. Liver biopsy, what to do prior to liver biopsy procedure. You are taking a blood thinner medication such as warfarin, Eliquis, Xarelto. If you are taking warfarin, you should recheck your INR about prior to the procedure. If your INR, you may need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is elevated, then you may need to adjust your dose to make sure your INR improve. Even your INR history is stable, and then you need to hold your warfarin for prior to the procedure. If your INR is very or critical, then you need to fix your INR and reduce. You need to hold your warfarin and reduce the dose and come back in 1 week to recheck your INR to make sure your INR improve or therapeutic before you can plan. You should follow your doctor who manages your warfarin or the anticoagulant closely. Have a good plan for your procedure. Anytime if you hold your 3 days, you might need to consider switching with the Lovenor injection. If you have a history of recurrent blood clot or stroke and risk of having blood clot or stroke, if you have to take the Lovenor injection, you need to follow who manage your warfarin type instructions closely. Make sure you understand you need to start Lovenor injection. When you need to stop the Lovenor injection right before the procedure. When you need to resume your Lovenor injection after the procedure. When you need to completely stop the Lovenor injection therapy. If you are taking Eliquis or Xarelto or Badaxa, you should check your kidney labs to make sure your kidney is normal. If your are more than 3 months old, and you should update labs. Any problems such as kidney or chronic kidney disease, you may need kidney labs sooner than 3 months. If your kidney function, if your kidney function is normal, then you for 2 days prior to the procedure. If creatinine clearance less than 50, then you may need to hold your Eliquis, Xarelto, or Badaxa, and you may need to resume about 2 to 3 days after the procedure. If your kidney function is normal, you can resume your Eliquis Xarelto Badaxa in 1 day after procedure. The day if your kidney function is not normal, your creatinine clearance less than 50, then you may need to delay resuming your Eliquis Xarelto or Badaxa. You should also check with the surgeon or proceduralist when it's safe to resume the platinum medication. Different. Let your doctor who manages your warfarin medication and anticoagulant so they can update the recommendation. If you have any question for the liver biopsy procedure, if you are taking warfarin or other platinum medication, please let me know in the comment box below. Thank you. Transurethral resection of the prostate, TURP procedure. What should you do prior to transurethral resection of the prostate procedure if you are taking a platinum medication, such as warfarin, Eliquis, Xarelto, or Badaxa? If you are taking warfarin, I would recommend you should recheck your iron about 2 weeks prior to the procedure. If you have a therapeutic INR, then you should hold for 4 to 5 days prior to the procedure. If your INR is elevated, you need to fix your INR, come back in 1 week to see if it improved, and plan for the procedure. If your INR critical, you need to hold warfarin, reduce the dose, and come back in 1 week, check your INR, plan for the procedure. Anytime you hold your warfarin more than 3 days, you consider reaching with the lobanal injection if you have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke. If you have to reach with the lobanal injection, you should follow the doctor who manages your warfarin or the anticoagulant instruction closely to understand when you need to start, when you need to stop before the procedure, when you need to resume it at the procedure, when you stop the lobanal injection quickly. If you are taking the Eliquis, Xarelto, or Badaxa, you should check your kidney function, your renal labs. Make sure you are up to date. If your labs were done more than 3 months ago, then you might need to repeat. If you have kidney disease, kidney failure, you may need repeat the lab sooner. If your kidney function is normal, you need to hold for 2 days. If your creatinine clearance less than 50, to hold more than 3 days, and you delay resuming. You should check with the surgeon or proceduralist to see if you are safe from resuming the platinum medication. If any different, you should check on doctor who manage your platinum medication, the anti-wave clinic. Make sure they have the updates. If you have any question or concern about this procedure, what to do prior to this procedure, and or if you are taking platinum medication, please let me know in the comment box below. Thank you. Bladder tumor procedure. What should do prior to bladder tumor procedure? If you are taking warfarin, Eliquis, Xarelto, or Badaxa, I would recommend you should recheck your INR about 2 weeks prior to the procedure if you are taking warfarin. If you have a therapeutic INR result, then you may need to hold the warfarin 4 to 5 days prior to the procedure. If your INR result is elevated, just slightly high, then and you have a stable INR history, then I need to adjust your INR a little bit to make sure it get back to the therapeutic range. Then you hold for 4 to 5 days prior to the. If your INR result is critical, probably you need to fix that INR by holding your warfarin and reduce the dose to make sure the INR back to the therapeutic range, or plan for the procedure. Anytime hold your warfarin more than 3 days, you need to consider switching the diclofenac injection if you have a recurrent blood clot or stroke history, and you have strong risk factor of having blood clot or stroke, then need to treat with diclofenac injection of warfarin for more than 3 days. Your doctor who manages your warfarin or the anticoagulant will give you a separate instruction for the diclofenac treatment. You should follow the instruction closely to understand when you need to start diclofenac injections, when you need to stop them before the procedure, when you need to resume them, when you need to stop the diclofenac injection quickly. If you are taking the Eliquis, Xarelto, or Badaxa, you should check your kidney labs make sure it's up to date. If they are more than 3 months old, then you may need the labs. If you have kidney failures or kidney disease, then you may need to consider updating your lab sooner than 3 months. If your kidney function is within normal limit, then you may need to hold for only 2 days prior to the procedure. If your kidney functions is not normal, as your creatinine clearance less than 50, you may need to hold more than 2 days. And you may need to delay resuming your Eliquis, Xarelto, or Badaxa. You should check with the surgeon or proceduralist. Make sure if you are safe to resume your platinum medication after the procedure. If anything different, you need to discuss with your doctor who manage for platinum medication or anticoagulant. If you have any question, concern, please let me know in the comment box below. Prostate biopsy procedure. What to do prior to prostate biopsy procedure if you are taking a platinum medication like warfarin, Eliquis, Xarelto, Badaxa. If you are taking warfarin, I would recommend that you should recheck your INR about 2 weeks prior to the procedure. If your INR history is stable and your INR result at therapeutic, then you will need to hold for 4 to 5 days prior to the procedure. If your INR history is not stable, your INR result is elevated, then you may need to adjust the dose, then come back 1 week if needed to make sure your INR improve before and plan for the procedure. If your INR is critical, then probably you need to hold your warfarin and adjust the dose, reduce the dose, then come back in 1 week. Make sure your INR is improved so you can plan for the procedure. If you have to hold your warfarin for more than 3 days, then you should plan bridge with the lower node injection. If you have history of recurrent blood clot or stroke and strong risk factor for having blood clot or stroke. If you have to bridge with the lower node injection, you should follow the instruction from your doctor who managed your warfarin or the anticoagulant to make sure you understand when to start the low enough injection, when you need to stop for the procedure, when you should resume the low enough injection. If you are taking the Eliquis, Geroto, or Badaxa, you might need to check your kidney function. Make sure you have up-to-date labs. If your labs more than 3 months old, then you need to repeat your labs. If your kidney labs are normal, then you may need to hold for 2 days prior to the procedure. If your kidney function is not normal, you have kidney disease, and your creatinine clearance less than 50, then you may need hold your Eliquis, Geroto, or Badaxa more than 2 days. If you have normal kidney function, then you might need to resume 1 day after the procedure. If your kidney function is not normal, then you may delay to resume your Eliquis 2 to 3 days after the procedure. Your doctor who manages your platinum patient or your anticoagulant should give you a complete instruction when to start, when to hold your Eliquis, Geroto, Badaxa, when to resume. You also need to check with the surgeon or the proceduralist, make sure when it's safe to resume your platinum medication. If they give you a different instruction than your doctor who manages your platinum medication or your anticoagulant, should discuss with the doctor or the anticoagulant. Make sure you are on the same page. If you have any further question concern about the prostate biopsy procedure, please let me know in the comment box below. Thank you. Kidney surgery or vascular surgery related to kidney. What should you do prior to this surgery? If you are taking warfarin, Eliquis, Geroto, or Badaxa. If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If you have stable INR history and your INR result is at therapeutic range, then you will need to hold for 4 to 5 days prior to the procedure. If your INR history is not stable and you have elevated INR result, then probably you need to fix your INR come back in 1 week to see if your INR improve, or you can plan for the surgery. If you have a critical INR result, then probably you need to hold your INR and use the dose. Come back in 1 week. Make sure your INR improve. You have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke, then you need a bridge with a low enough infection. Your doctor who manage your platinum medication, warfarin, the anticoagulant, will give you a separate instruction. Make sure you understand when you should start the low enough injection, when you need to stop right before procedure, when you need to resume after the you should follow the instruction closely. If you are taking Eliquis, Yeroto, or Badaxa, then you need to check your kidney function to make sure you have the up-to-date that required. If your lab more than 3 months old, then you need to repeat them. If your kidney function is normal, then you may need to hold for 2 days prior to the procedure. If you have kidney disease or kidney failures, and your creatinine clearance less than 50, then you may need to hold for more than 3 days. When you are required to hold for more than 2 days, then probably you need to delay to resume. So if your kidney function is normal, you may resume the day after procedure. If it's not normal, you may resume 1 day, 2 or 3 days, depend on your kidney. You must also check with your surgeon or proceduralist to see it's okay for you to resume your platinum medication as instructed by the doctor who managed your platinum medication or the anticoagulant. If it is different recommendation, then you need to discuss with your doctor who managed your platinum medication. If you have any further questions, please let me know in the comment box below. Thank you. Kidney removal procedure. What should you do prior to kidney removal procedure? If you are taking a platinum such as warfarin, Eliquis, Yeroto, or Badaxa. If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If you are stable with warfarin for a few months, then and you have a therapeutic result, you may need to hold 4 to 5 days prior to the procedure. If your INR result a little bit high, then a little bit elevated, you may need to adjust your warfarin dose a little bit then hold 4 to 5 days. If you have really high or very elevated INR or critical INR, then probably you need to fix your INR to make it therapeutic before you can plan for the procedure. You may need to come back in 1 week to see if your INR improve, so you can plan for the procedure. And if your INR improve, then you might need to hold 4 to 5 days prior to the procedure. When you hold your warfarin more than 3 days, you should plan for reaching with a low-venom injection. If you have a history of recurrent blood clot, recurrent stroke, and strong risk factors of having blood clot or stroke. When you have to prescribe the low-venom injection, it should give you a separate instruction when you need to start your low-venos, when you stop before the procedure, when you should resume your low-venos after the procedure. If you are taking Eliquis, Xarelto, or Pradaxa, you may need to check your kidney function. Make sure you have up-to-date labs. If you have your current labs more than 3 months old, in the labs within normal limit, then you may need to hold for 2 days prior to the procedure. If your kidney labs not within normal limit, if you have kidney disease and your creatinine clearance less than 50, then you may need to hold more than 2 days. When you need to hold more than 2 days, then you may need to delay to resume your Eliquis, Xarelto, or Pradaxa. So, your doctors who manage you, Eliquis, Xarelto, or Pradaxa, or the anticoagulant, will give you the complete instruction when you need to hold Eliquis, Xarelto, or Pradaxa and to resume after the procedure. However, you should check with your surgeon or proceduralist to make sure you are safe to resume your platinum medication. If you need to delay to resume your platinum medication, then you need to discuss that with your doctor who manages your platinum medication. If you have any further questions, please let me know in the comment box below. Thank you. Kidney biopsy procedure. What should you do prior to kidney biopsy procedure if you're taking platinum medication such as warfarin, Eliquis, Xarelto, Pradaxa? If you're taking warfarin, you should recheck your INR about 2 weeks prior procedure. If your iron history is not stable and your current iron is critical, then you need to make sure your iron back to normal at therapeutic level. So they might need to hold your warfarin and reduce the dose and have you come back in 1 week to make sure your iron return to the normal range, to the therapeutic range, before they can plan for the procedure. When your iron has the therapeutic range, they will have you to hold for 4 to 5 days prior to the procedure. If you have medical condition indicated you must be breached with the Lovenox injection, then your doctor who manage your warfarin or anticoagulant, they will instruct you how to start your Lovenox injection, when to stop, hold more than 2 days. If you have normal kidney function, you only need over 2 days prior to the procedure. If you have kidney disease or kidney failures and your creatinine clearance less than 50, then you may need to hold Eliquis, Yeroto, or Badaxa more than 2 days. When you have bad kidney function, then you may need to delay to resume your Eliquis, Yeroto, or Badaxa. Your doctor who manage your blood thinner medication or your anticoagulant will give you complete instruction when to stop, to resume Eliquis, Yeroto, or Badaxa based on your kidney labs. But you may need to ask or check with your surgeon or proceduralist when you to resume. They need to, or you need to discuss that with your doctor, manage your blood thinner medication or your anticoagulant. If you have any further question regarding your kidney biopsy procedure, let me know. Prior to ablation procedure, what should you do prior to ablation procedure if you are taking platinum medication or when you're taking platinum medication? Do not hold your platinum medication unless otherwise as instructed. For warfarin, you should test for INR weekly, 3 to 4 weeks prior to the procedure. Test INR weekly, 3 to 4 weeks post-procedure. Your INR must be therapeutic every week before the procedure. If for some reason your INR not therapeutic, then they need to restart the cycle. If you take Eliquis, Yeroto, or Daxa, you should continue taking this medication unless otherwise as instructed. If you miss any dose, report to the proceduralist or the anticoagulant. Cardioversion. What to do prior to cardioversion procedure if you are taking blood thinner medication such as warfarin, Eliquis, Xarelto, or Pradaxa. Typically, you must be on blood thinner medication before they can the cardioversion procedure. And do not hold your blood thinner medication prior and after cardioversion. You must test your, if you take in warfarin, you must test your INR weekly. You must test your INR weekly for 3 to 4 weeks prior to the procedure. And then test your INR weekly for 3 to 4 weeks post-procedure. Your INR weekly must be therapeutic or in range before they can perform the procedure. If you are not therapeutic, not in range, they need to restart the cycle 3 to 4 weeks prior to the procedure. And then after the procedure, you are not supposed to be therapeutic. If not, if you are not too low, they may need to reach you with a Lebanon injection. For the Eliquis, Xarelto, or Pradaxa, you have to continue taking this medication. If you miss any dose, you need to report to the procedure list or your anticoagulant or the doctor who made the warfarin or medication. So generally, you should not hold your blood thinner medication before and after the cardioversion, always or with after. If you miss any dose, you should let your doctor know, the surgeon or proceduralist or the anticoagulant, so they had to adjust your cycle. Most of the hospital, they prefer you to take warfarin before after the cardioversion instead of other blood thinner medication, Eliquis, Xarelto, or Pradaxa. If you have any further question, please let me know in the comment box below. Thank you. What should you do prior to cardiac catheterization podcast when you or eat blood thinner medication such as warfarin, Eliquis, Xarelto, or Pradaxa? Cardiac cath is the surgery. So if you take warfarin and you are stable with your INR history, or if your INR is stable for a long time, then you should recheck your INR about 2 weeks prior to the procedure. need to hold your warfarin 4 to 5 days. The procedure. You may need to be breached with a Lovenox injection if you have a history of recurrent blood clot or stroke, or strong for the risk of stroke or blood clot when you are bleeding. If you have to breach with Lovenox injection, and you need to follow your doctor who managed your warfarin or the anticoagulant to understand when to start the when to stop right procedure and when you can resume the Lovenox injection. If your iron are slightly high, you might require to reduce the dose and recheck in 1 week, or reduce the dose and hold for 4 to 5 days prior to the procedure. Aliquis, Xarelto patient, they might need to check the kidney lab, make sure their kidney is normal. They update the labs if their previous labs were done more than 3 months. If their kidney function is normal, they may need to hold for 2 days prior to get surgery. If they have kidney function or chronic kidney disease and creatinine difference then they may need to hold more than 2 days. If they have hold for more than 2 days, then they might need to quick Xarelto or Badaxa. So the doctor who managed your Aliquis, Xarelto or Badaxa will give you specific direction or instruction when to hold your Aliquis, Xarelto or Badaxa and when to resume. But you should check with your surgeon or procedure list to make sure when to resume, because some may have bleeding after the procedure. So your surgeon or procedure list may resume the platinum medication. Please let me know if you have any questions in the box below. Hello, what should you do prior to colonoscopy procedure if you are taking platinum medication? such as warfarin, Eliquis, Xarelto, or Badaxa. For warfarin, you should recheck your INR about 2 weeks if the INR is therapeutic. Then should hold your warfarin for 4 to 5 days prior to the procedure. You may need to be breached with a long injection if needed. If you have recurrent blood clot history or recurrent stroke history or any strong risk factor, it have high risk of blood or stroke when you off warfarin more than 3 days, then need to be breached with the